Sweeties, let's seriously talk about erectile dysfunction, known as ED. See, let's get to understand the causes of ED because this ED is really dealing a lot with our men. First, let's get to know the causes of this ED. This ED, which is erectile dysfunction, is said to be the inability to maintain or to have an erection. The inability to maintain and to have an erection. This is what it means. And there are certain diseases, conditions, medications, and psychological things, behaviors that can cause this ED. And we are going to look into them one after the other. First, we will start with diseases. We have chronic kidney diseases. Chronic kidney diseases causes ED. We have the second one, which is diabetes, especially type 2 diabetes. We have the third one, high cholesterol, which is known as hyperlipidemia. We have the fourth one, heart and blood vessel diseases. We have the fifth one, which is the development of scar tissues inside of the penis, which is known as Peyronie's diseases. We have the Parkinson diseases, and we have surgery for bladder cancer, and we have surgeries or injuries that affect the pelvic or the spinal cord. These are the diseases that can cause ED. Now get to know the medicines that can equally cause this erectile dysfunction. We've gotten to know the diseases. Now let's get to know medicines that can cause this. Number one is ulcer medicines. Ulcer medicines can cause erectile dysfunctions, antidepressants, anti-androgens. These are used for prostate cancer. We have the appetite suppressants. This is medicines that makes you less hungry. And we have the sedative medicines. These are medicines that can cause ED, like causing them erectile dysfunction. And most times, our psychological and emotional issues can equally lead to this ED, and in most cases, worsen it. And you can equally develop this ED if you're having one or two out of the following. The first one is stress. Do you stress yourself? When you stress yourself, then get to know that you're prone to having ED. The second one is fear of sexual failure. Third one is depression, anxiety, low self-esteem. These are the psychology and emotional part that can affect you. Now, let's get to understand some behaviors that can equally cause ED. What are some behaviors that when we are prone to have ED, or it can be easy for us to have ED? Number one is using illegal drugs, smoking, overweight, and drinking too much of alcohol. These are the behaviors that can cause ED. So experiencing this ED can affect our self-confidence. If you're a man and you're experiencing this ED, it will affect your self-confidence, it will stress you, it will make you to have an unsatisfying sex. Like most times, it can equally affect your relationship and also the inability to get your partner pregnant. These are equally the risk factor of this ED. These are the things that this ED can lead you to or can cause you. So now that we've gotten to know the causes of this ED, what are the preventive measures? In order to prevent ourselves from not having erectile dysfunction, men, you have to quit the above mentioned behavior. Then, before you take any medications, you have to meet your doctor, talk with your doctor so that your doctor can tell you the appropriate dose to take it so that it won't affect your erections. Then, when it comes to psychology aspect, You have to know how to deal with stress, stop having fear of sexual failure, know how to deal with your depression and anxieties. And equally, if you're dealing with the above health issues, you have to talk well with your doctor. So your doctors can give you medicines that can help you. When we come to the behaviors, you have to quit smoking if you're a smoker, if you use illegal drugs, if you're overweight, and if you're drinking too much alcohol. You have to work on it. You have to work on it because a lot of guys, a lot of men out there maybe might be shamed to move to someone and be like, I don't maintain my erection, but trust me, when you go to your doctor, complain to your doctor, they are the only ones you can confide in, and they are the only ones that can give you solution to your problem. So it is a best idea to move to your doctor, talk to your doctor. Your friend is not your doctor. Talking to your friend about your issues can't save the matter, my dear. Only people that can save the matter for you is your doctors. So move to your doctor, explain to your doctor what you're battling with. Then your doctor would assist you in the appropriate way, give you medications, and equally guide you on how to take it. If you find this video to be helpful, please don't forget to like, share, and comment. And don't forget, this is Psychology Flow.